after 1:30 a.m. and I tried to go to bed and I had terrible pain here, which isn't even where I had the surgery, and my son just stood in the bedroom talking to me and distracting me, and then he came up with the theory that it's probably gas bubble trap. So I remember the best thing for that is to get up and walk around, which I've been doing, even though all I want to do is sleep. I found myself some peppermint tea, because that helps, and I've got movement at the station, and the pain has moved from where it was down here, down to here. So I'm hoping for a few really big burps, a few really big farts that I'll aim my son's way, and then I might be able to get some sleep. I think it's about 3:45 a.m. I've only just come back to bed. I am actually surprisingly not that tired. I did have some Endone and some Maxilon and some Panadol. I have been doing laps of the house since about 1:30 a.m. I got all my tidying up done. I got the kitchen cleaned, although my son did the dishes. I did the other side. It wasn't really dirty anyway, just had to wipe the benches and stuff. And I've come to bed and this pain has started up again, but I'm just so freaking tired. I don't know what to do with it. I don't know why it's hurting. But I've got some Tarjan there on my bedside table. If this doesn't ease up, I'll take that as well. And I can actually take that. I've been given the go-ahead to do that. So here's hoping that I can at least get a few hours sleep without pain. It's funny, when I sit up in the lounge room, the left side hurts, the right side is fine. As soon as I lay down in bed, the right side starts up, left side doesn't hurt. Anyway, I'm going to try to sleep now. Hi, I'm Trish. Having seen the little snippet that I just posted now, you can probably tell I'm not feeling so shit hot today. It's Panadol o'clock. I don't normally have dissolvable Panadol, but I got some because I'm on fluids and I wasn't sure that I'd be able to swallow tablets. I think I will. I'll use these up, but then I'll just use normal tablets. Yummy lemon flavour? That's bullshit. That's a lie. But it's not forever. So, I had my Lapband revision surgery yesterday. They revised the tubing, which means they made it shorter. And I think they may have gotten rid of some adhesions, but I'm not really sure. No one could tell me, but I did hear some nurses talking about adhesions when I was all, dopey when I first came out of the anaesthetic. So I might have made that up in my head. I'm very, very, very sore. I'll tell you the story from the start. I had to be in at the hospital yesterday at 12 noon, and I had to get public transport there. That took about 2 hours, but it's not a bad trip. I hate being on the train, and the bus and the tram, but it's not a bad trip all up. So I got in there, didn't wait very long at all. It was in the Alfred in their day procedure centre, which is it's actually quite nice in there. And so I got called in to see the nurse first, and they just go over, what do you weigh and when was the last time you ate, and they take your blood pressure and all this sort of thing. And then I got called in to see the anaesthetist. He was very, very nice. I told him I was very, very, very anxious because of how I came out of the last anaesthetic when I had my boobs done 7 weeks ago, and he explained all that to me, explained, why that happened, and that he'd look after me and try to make sure that didn't happen again. And, he was so lovely. He even gave me a local anaesthetic to do the IV, which I've never had before. It was a little bit odd, but, it was very nice of him. Who else did I see? A doctor. And I am not dissing the Alfred Hospital in any way or dissing this doctor. Nothing like that. But when I saw her, I said to her, because, she went over the procedure that I was having, revising the tubing of the Lapband. And I said to her, will you also be looking for adhesions and hernias and checking the port is okay and checking the placement of the band around my stomach and everything? And she said, well, no, we're just going to be doing the tubing. That's all that's written down. And I said to her, yeah, but while you're in there, you've got to go into my body anyway, I'm worried that if you only do the tubing, and I've gone through this surgery, and that doesn't fix the pain, then I've got to have another surgery then to look for adhesions and, proper band placement and hernias and all this sort of thing. And she said, oh, no, if you had a hernia, it would have showed up on CT. And I said, yeah, but what if it didn't show up on the CT? Because I have done, and I'm not a doctor, but I have done some reading that says that if a CT is done with you laying down, sometimes you can't see the hernia. But anyway, so she said, no, we're not going to be looking all over your abdominal cavity for all this stuff. And, I didn't want them to look all over it, from everywhere. I just wanted them to look for an incisional hernia where they went in last time. And, they went in there anyway. So maybe they did look for hernias. I don't know. So anyway, then they took me to get changed and wore that lovely sexy hospital gown that you would have all seen yesterday with the little booties. And then they took me to, they've got a little waiting room and you're sort of called in and out, you've got to see the nurse and you've got to see this one, you've got to see that one. And they eventually took me to the little waiting room where they put you on the trolley and they do the IV and they get you to sign paperwork and all that sort of thing. And I was very, very, very anxious by then. So the surgeon gave me some of the anaesthetic a bit earlier to try to calm me down, but it didn't. It just made me feel really woozy. So then he gave me something else that worked to treat. Then I didn't really care so much anymore. It's like you can still feel the anxiety, but it doesn't really matter anymore. He also gave me some antibiotics and some anti-inflammatory. He said that would last for 24 hours. And then they took me through to theatre and popped me off to sleep. Oh, they also, they give you the gas mask. I don't like that. I feel very claustrophobic in it. I feel like I have to breathe too hard to get the air in, but, it's all part of it. So they popped me off to sleep and thankfully I came out of the anaesthetic fine. I did have some pain, but it was only about a 6 or a 7, so they gave me some Endone or Oxycontin or Oxycodone, whatever it is, when they put it through the drip, and some antiemetics because otherwise I would have felt sick and I certainly did not want to be vomiting. I'm just going to... That lovely lemony taste. I've got to try and get this down, but it takes me a while. Yeah, so they did that and, just monitored me. I think my blood pressure was a little bit high, but, that's pretty normal. So they kept me in recovery for a while. I felt really dopey, but that was probably all the painkillers and the antiemetic and the anaesthetic and everything. I just sort of felt like I was having trouble staying awake. Now, when I went into theatre, it was around about 1:30. When I woke up in recovery, I managed to look at the clock and it was 3:15. So I don't know how long I was asleep in recovery before I woke up, so I'm not sure how long the surgery went. And I think I did ask, and I think they said about an hour to an hour and a half. But I might be making that up as well. But it was really, time is really weird when you're coming out of a general anaesthetic, because I looked at the time, it was 3:15. And then I felt like I'd been laying there for hours just trying to, I was sort of trying to doze, but I couldn't quite sleep and, just sort of waiting for the painkillers to work. And then it honestly felt like at least an hour had gone by, and I looked at the clock again and only 10 minutes had gone by. And then I looked at the clock again and an hour had gone by. Time is just really weird. So yeah, the painkillers, they worked pretty well, took my pain level right down. And then they wanted to wheel me around to another area. And I know from past experience, I cannot have my eyes open when they do that, otherwise I feel very, very, very sick. So it was eyes closing time. So they took me there. I was just to a corridor, because then they take you just to the pickup room, because I was allowed to go home yesterday. So I had to get up off the trolley and walk over to a recliner, and I just got this, I thought I was being very careful with getting up and not using my abs, but I did, and it really hurt. So they put the bed up a bit more for me, and they dropped my feet down, and they, gave me a rail to hold on to, and I was able to get up. That was okay. And then went sat in the recliner and just waited for, I don't know, a couple of hours for my sister to get there. She had bad traffic and she got lost and she had to pick up my son on the way and everything. So she came and I just had a cup of tea and lots of water and some ice cream because I'm on fluids now for 2 weeks. They didn't have any jelly. I would have preferred jelly, but they didn't have any, so I had ice cream and it was pretty yummy. So there, my sister came and helped me to get dressed, and we went home. It was about, probably ended up being an hour and a quarter home because she wanted a cheeseburger on the way home and I was absolutely parched. I needed to, so I got a great big gigantic water from McDonald's and I actually wanted an ice cream from there, just one of the cones, but they didn't have any. And then we had to stop at KFC for my son because he was starving to death. And then we had to stop at the chemist so I could get this delicious dissolving Panadol. So we finally got home and my sister had to leave. She had to go home, get dinner and all the rest of it. But my son stayed with me last night and he's an absolute treasure. He's just so patient and, it's making me, actually I made tea. He made me some tea and I made some tea, and because I find I feel better if I get up and do what I can. And we just sat and we watched NCIS, 3 hours of NCIS, and just talked, and because he doesn't live here anymore and I miss him sometimes, so it was really nice to have him here. And then I had to wait up till 11:30 to have more Panadol, and then before I knew it was like 1:30 in the morning, and well, we better go to bed. So I tried to go to bed, and my son came in with me to make sure I was going to be okay, and we were just talking. And I made a great big nest up with all my pillows, 6 pillows, and every time I tried to lay down, I just got this really bad pain in the right side. So, but my son was there and he helped me to sit up because I don't know if this has ever happened to you, but you get in that half sort of sat up and half laid down position and you can't go either way because of the pain, so you get sort of stuck there. But he helped me up a few times and he was really good getting me, wheat bag and hot water bottle and all that sort of thing, medicine and everything. So anyway, after trying to get comfortable for a while. Actually, I must have gone to bed at about 12:30 because I sort of persistently just stood there talking to me. We had this big philosophical discussion about, reality versus illusion, and I love talking to my son. So anyway, about 1:30, we decided that I must have had a big gas bubble, and so the best thing for that would be to get up and walk around, and I found some peppermint tea, so I was just doing laps around the house, and my son was really funny. He just followed me around with my really super cool, super fun pickup stick, and just picking up stuff, just anything he could see, just picking up because it's it's fun. So I walked around till about 3:45 a.m. and he just followed me, and I had a couple of cups of peppermint tea. Went to bed again because he was dead on his feet by then as well. And I wasn't really tired, but I was just exhausted from the pain. So I went to bed and managed to get comfortable with a hot water bottle and all my pillows. I finally sort of got the right combo of pillows and slept till about 6. And I woke up, had to go to the toilet and had some more Panadol. And then I went back to bed and managed to sort of little tiny bit sleep on my side, just sort of like with my hips tilted up a little bit. I can't sleep for too long flat on my back or I get very, very sore. So I managed that and then, woke up again, I don't know, 8 or 9 o'clock, I guess. So I had a few hours sleep and then I just laid in bed for a while just being lazy, and my son got up and made me a cup of tea and got me some soy milk to have my medicine because I had to have Endonen and Maxilon, and I didn't want to have those on an empty stomach, and milk is it's a protein, it lines your stomach. So then I got up and had a shower, and now I'm just sitting up and I've got my tea. I've got some bananas out, frozen bananas. I'm going to make a smoothie with coconut milk and frozen bananas and some avocado and some chocolate protein powder. So that'll be nice and high in fibre and protein. It'll fill me up and keep me going. And I've got some a couple of different soups there that I made over the weekend to have for my other meals. Other than that, I am in a bit of pain when I move. I am hoping that I won't need to have any more endone or Maxilon later on. I'm hoping that the Panadol will keep everything in check. And other than that, I'll probably go and see my GP on Saturday, or a GP. I don't think my GP will be there on Saturday, but I will see a GP and they can check the dressings, which are looking pretty good. One of them's bled a little bit, but the nurse said as long as it doesn't leak out of the actual tegaderm, to leave it. So that's what I'm doing, that's my plan. But I have some more tegaderm and gauze and saline and steri strips in case it does come off. So that's all I can think of, but my brain is still a little bit fuzzy, so I might have forgotten some stuff. But I will, if anything happens, I'll update you, and I'll do an update when I've been in to see the GP for a checkup. Oh, and I'll go back to the bariatric clinic in probably about 4 weeks to see the surgeon, and then I will find out, although I know that they will send a report to my GP, so I'll see my GP before then and find out exactly what was done. So that's it for now.